Next up is Stephanie Hausnecht, one of our intrepid pharmacists. And pharmacists, as a part of our team, are indispensable. They provide us with information about therapies and toxicities and administration of drugs, and they help us coordinate with patients about starting medications. It is part of our multidisciplinary team. So we are delighted to have Stephanie join us today. Thank you.
Thank you, Dr. Lipson. Thank you to Mara for inviting me. I will make a disclaimer, as one of our other speakers did. I am actually a thoracic pharmacist. However, there are a lot of overlaps between melanoma and lung cancer, and most of the therapies that we use in melanoma, we use in lung cancer as well. So I knew I was kind of coming at the end of the session today, and I knew that a lot of the colleagues coming before me would talk about therapies. So I was thinking to myself, what would be the most useful for your time? And that is for you to walk away with an understanding of what a pharmacist can do for you as a patient, and also for you to have an appreciation of how we interplay with your whole care team. Okay, so we go to school specifically for drug therapy. So we have been called the cancer medication experts. I think what's really important to know, though, is that we are a collaborative member of your healthcare team, and we help your team to make evidence-based decisions that are individualized to you as a patient. I'll give you some examples of how that can come into play here in a bit. We also help to bring new therapeutics to the healthcare system, both efficiently and safely. So Dr. Warrior talked about all of the agents coming down the pipeline, and a recent example is the tumor infiltrating lymphocyte therapy, or TIL therapy. Pharmacists play a role in bringing that through formulary at a place like Hopkins and making sure that we can deliver that therapy to our patients both safely and effectively. We help with 4 main pillars. We can provide drug information, not only to patients, but to the care team. We help with medication access. That's a big thing. It doesn't help for you to be recommended for a therapy if you can't actually get access to that medication. We do a lot with education of both patients and caregivers. And then we also help your care team with longitudinal monitoring. You've seen different iterations of this slide, but these are all the therapies that we have available, and I've put them into boxes based on broadly how they work. We have our checkpoint inhibitors, which are broadly speaking our immunotherapies. We then have our targeted therapies, in particular for patients who have those BRAF mutations. We have our tumor infiltrating lymphocyte therapy, which Dr. Scharfman spoke about. It's one of our newer therapies. And then we have our traditional chemotherapies. And these are different, despite the fact that I see a lot of misinformation, even amongst radiologists and emergency medicine doctors. These therapies work differently, and their toxicities are very different. Very briefly about medication access, because I could spend an entire hour plus talking about this, but I think this is important for patients to know and understand. And unfortunately, we don't have a good system in the United States for educating just citizens. I mean, I think we should probably be teaching this in high school, but navigating health insurance can be really tricky. We have 2 main branches. We have our medical benefit and our prescription or drug benefit. So regardless of whether you are a Medicare beneficiary over the age of 65, or you have commercial insurance through an employer, you will have a medical benefit and a prescription benefit. Infusion therapies, so therapies that you have to come into the clinic to receive, those are billed under your medical benefit. So if you have Medicare, that's Medicare Part B, as in boy. And Medicare covers 80% of the cost of those therapies. Now, for that other 20%, most people will enroll in a supplemental plan to help to cover those costs so that there's not a lot of out-of-pocket costs. Oral therapies, which I think are very poorly understood as far as medication access, they are covered under your pharmacy benefit because they can be self-administered by the patient in the home. You don't need to have us watch you take a pill every day or have a nurse administer a pill to you every day. So these therapies are covered under Medicare Part D, as in dog, and you have to sign up for a separate pharmacy benefit if you're a Medicare beneficiary. And open enrollment is going to be starting here soon and going through the beginning of December for 2026. The BRAF MEK inhibitors, of which there are 3 couples, they are specialty medications. That specialty medication designation means that it comes with a lot of red tape behind it, okay? These therapies are very expensive. They're anywhere from $10,000 to $20,000 a month out of pocket. And so they have a very specific process for the insurance to ensure that they are being used appropriately and that a patient is a good candidate for them. That usually involves a prior authorization process. So just because a physician is ordering them does not mean that the insurance will automatically approve them. They often ask for some additional clinical information, and that can take anywhere from 24 to 72 business hours. Assuming we're able to get authorization through the insurance, these specialty medications often have to be dispensed by certain specialty pharmacies. You can't go down the street to Walgreens or CVS and expect to pick these medications up. They also may be associated with high out-of-pocket costs, and that is because they Medicare Part D, you can't sign up for a supplemental plan for Medicare Part D, right? So whereas infusion benefits, you have 80% coverage by Medicare, 20% with a supplemental plan, Medicare Part D is kind of standalone for drugs. The good news is that pharmacy team has a lot of individuals that work through medication access, and there are resources out there through both pharmaceutical companies as well as grants and charity organizations. So you might be eligible for a patient assistance program, a grant, or a copay card to help offset some of those out-of-pocket costs. Okay, we talked about BRAF/MEK inhibitors. I just wanted to kind of give you an overview. In the top in blue are some of the class effects. So there are 3 different couples: vemurafenib, comimetinib, dabrafenib, trametinib, and encorafenib, binimetinib. They, in general, are pretty well tolerated therapies, but they do have some unique toxicities. Some patients report fatigue. We can see rash, diarrhea, and joint pain. There's some rare toxicities. These are the things that I usually talk to my patients about, and I want them to understand what sort of symptoms we would want them to report. But things like inflammation in the lung, a side effect called pneumonitis, can be seen. Sometimes patients can have blood clots or have increased risk for bleeding. And these medications can reduce your ejection fraction, the heart's pumping efficiency, so something we need to monitor for. And then they rarely can have some unique eye toxicities or ocular toxicities where we might need to get you in to see an eye doctor. And then each of the individual combinations have some own unique toxicities, and that's kind of where pharmacists come into play. We'll look at a patient's profile, we'll look at the medications that they're on, we'll look at their comorbidities, other conditions that they have. We might pick out something that your doctor might have missed or didn't consider that would push us to prescribe one of these couples over the other. Some things that are unique: vemurafenib, we can see photosensitivity reactions, tends to be a little bit higher incidence of having elevated liver function tests. With dabrafenib, trametinib, this is the pair that has the famous fevers and chills. So you can see drug-induced fevers that can be really bothersome for patients and can recur. Also, if a patient has comorbid diabetes, maybe not the best bet because this pair can cause elevated blood glucose. And then with encorafenib and binimetinib, these are our newer pair. They're generally speaking better tolerated. I heard Dr. Scharfman say they're his preferred couple, but they can prolong the QT interval. So if we have a patient who has a borderline QT interval on EKG, that can set them up for an increased risk for arrhythmias. That might be something that we have to monitor more closely. Or these combos can cause an elevation in creatine phosphokinase, which is a lab marker that can be an indication of muscle inflammation or damage. I know Megan talked to you about immunotherapy toxicity. So just as a reminder and a refresher, when we give checkpoint inhibitors or other immune-based therapies, we can see inflammation anywhere in the body, right? We want to engage T cells to fight the cancer, but we can sometimes have those T cells go a little haywire, and we can see any of the itises from top to bottom. I think what's important to know is that these toxicities are readily treatable, especially with prompt reporting. So we talked about prednisone and steroids and how they're kind of the mainstay of calming down that inflammation. We want to start them early. We don't like patients to be on them long term, though, because they can be associated with some complications and side effects. I think it's important to know that when we use these steroids for the treatment of toxicities, they don't appear to reduce the response to the checkpoint inhibitors. When we first started using these widely in the clinic, I would always worry that patients wouldn't want to report certain side effects to us because they didn't want us to stop their checkpoint inhibitor therapy for fear that we would maybe lose control of their cancer. But when we are using them to treat toxicities, that does not appear to be the case. But we generally don't want patients to be on other immunosuppressants for other causes. So Megan also mentioned that we don't really like patients being on steroids for a long time. So if we see a patient that's going to have to be on prolonged steroids because of an immune-related toxicity, we might add another biologic immunosuppressive agent. That's where pharmacists can help come in to play, getting access to those. But if you are on steroids, pharmacists are going to be in the background making sure that we're not causing more problems with the treatment of your toxicity, right? So we don't want these iatrogenic or treatment-induced problems to occur. So we're going to be thinking about all the supportive care of someone that needs to be on steroids while we're getting their checkpoint inhibitor toxicity under control. We want to make sure that you know you're taking your steroids with food, that you might need to have acid suppressant medication. We're going to be thinking about infectious disease risk from prolonged steroids. If you're diabetic, we're going to be making sure you have good glucose control. And we're also going to be making sure that we're considering your bone health and decreasing your risk for osteoporosis, making sure you're getting adequate calcium, vitamin D. And that leads me into supplements, right? Because unfortunately, a large part of my job is answering questions from patients about supplements, okay? So this is my plea to you. I am begging you. The supplement industry is not regulated, okay? The supplements can come to market without any scrutiny, and anybody can sell anything on Amazon or any internet site, okay? None of the claims that the supplement industry makes has to be substantiated, and not all supplements are safe. Okay, so just to go over a few ways in which supplements can harm the drug therapy that we want you to be on. They can cause medications to break down faster, right? So if you're on one of the BRAF/MEK inhibitor combinations that I mentioned, some supplements can actually cause the drug levels to decrease because of interactions in the liver. Sometimes they can do the opposite. They can actually slow down the metabolism of the prescription drug, which could increase your risk of side effects. And then some supplements just contain contaminants that are themselves toxic to the liver. So two important resources that I do trust, that if you do want to do your research, the NCCIH has an Herbs at a Glance website that has about 50 different common herbs and supplements. It's written for patient-friendly language, and it goes through what is known about that herbal or supplement and what are the potential risks or drug interactions. And then Memorial Sloan Kettering, which is a NCI designated cancer center up in New York City, they have a site called About Herbs that also has a patient-friendly facing portal. There's more than 300 herbs or supplements there. So if you are interested in a particular supplement and you want to try to do your research, these are two resources or references that I trust. Here's just an example. And this is truly a supplement that I was sent by one of my patients last week, okay? First and foremost, warning sign, proprietary blend. Okay, what does that mean? Okay, I wouldn't give you a cup of coffee and say, well, it might have 50 milligrams of caffeine or it might have 500 in it. I don't know, right? It's my proprietary blend. You don't want to take anything that says a proprietary blend, okay? One ingredient here, and I just pulled a couple of them. One ingredient has estrogenic properties. So if a patient has a history of breast cancer, that could be concerning. Some supplements can have anticoagulant properties, which could increase your risk for bleeding and is a problem if you're on a blood thinner medication. Sometimes we have drugs that can inhibit drug efflux transporters. So again, that's a way in which it can lead to drug interactions. We also have supplement ingredients that can interfere with liver metabolism. And then finally, I did actually pull the research for this. I went to the company's website and I was just kind of say, what are they putting out there? What are they trying to sell to patients? Kind of what's the grab? And if you read the fine print, because they are touting that this was studied in well-controlled clinical trials, which kind of question that. But one thing they specifically said is while they didn't find any side effects from this particular supplement, they did not study the way in which this supplement affected the anti-cancer agents that the patients were on, right? So they were marketing it to patients to decrease the risks of chemotherapy side effects, to recover blood counts faster, but they never looked at whether there was any adverse impact on the cancer treatments themselves, okay? So just an easy example of ways in which we really want to try to avoid these types of supplements. Another one, this stands out to me, melatonin supplements. So this is from our neighbors up north. This group of researchers took over 30 different supplements that they could buy at grocery stores and pharmacies in Canada, and they sent all of them off for laboratory testing. The melatonin content of the different supplements varied from having 17% less of the melatonin than it said it did on the label to more than 5 times the amount of melatonin that it said it did on the label. Okay, less than 70% of them actually had within a 10% range of what was labeled. And what's also concerning is you think, okay, I find a product, it works for me, I'm going to stick with that brand. Well, even between lots, so from lot to lot of the same product, the amount of melatonin in the supplement could differ by as much as over 450%. So this is my plea. If you are considering supplements, have a valid reason to do so. There must be some reason you want to take a specific supplement, whether it's to increase what you think is increasing blood counts or to improve energy levels. Make sure you at least have some valid reason, not just that your sister's friend recommended it or she had cancer and this, helped her, etc. Do your research and be wary of bold marketing claims. Generally speaking, if something sounds too good to be true, it is. And then always make sure you're purchasing supplements from a reputable source with third-party testing. What is third-party testing? That's where the company pays money to go send it off to an independent lab to verify that what is on the label that they are putting on the product is actually in the label. Okay. And that costs money. So generally those supplements do cost a little bit more, but then you have the peace of mind that at least you are getting what you are paying for. How else can you utilize your pharmacist other than asking me to review your supplements? Make sure that you're comfortable asking us questions, right? We're very accessible. We've been called one of the more accessible healthcare providers, and that's because we are generally in clinic 5 days a week. We have heard absolutely everything. I mean, I can't even repeat some of the questions that I have been asked, but there is no stupid question. I know that this is overwhelming to a lot of patients, and I am more than happy to spend the time to answer the questions that you have. It's okay to ask for a clarification. So if you had your visit with your doctor, you wrote down some notes and you're kind of going back to them and something doesn't make sense, we're happy to help clarify things there. Always bring a care partner with you, somebody who's having another ear open to listen to the things that are being said, because again, we know that this is overwhelming. And always inform us when you have new medications or supplements that you're prescribed. So if you can't keep your doctors all within the same health system, let us know when maybe a general practitioner or an urgent care facility has prescribed you a new medication so that we can make sure that there's no issues with your prescription drug products. With that, I think we're going to hold questions for the end. As I mentioned, I am not the melanoma pharmacist, but there is one now, and we are always happy to answer any questions that you have, and my chart's a great way to get a hold of us.